At the University of Regina, the Equity, Diversity and Inclusion Digital Resource Hub showcases impactful EDI initiatives across the campus.
It's a centralized, accessible resource for our community and post-secondary institutions nationally.
Join us to hear the stories behind the initiatives shaping our campus.
So we have, our programs are a collaborative program between the University of Regina, Faculty of Nursing, and SAS Polytech. And we have an undergraduate and graduate program. The undergraduate program is the SCBSCN, the graduates, the CNPP. Both of those have designated Indigenous seats. And the percentage of the seats that are designated as Indigenous are what's consistent with the Saskatchewan Human Rights Commission, so 17%. So currently we have 135 self-declared Indigenous students in the undergraduate program, and we have 18 in the graduate program. To date, we've had 455 self-declared Indigenous students in the undergraduate, and we have 220 graduates. And we have another 5 graduates from the graduate program who are finishing in November. We know that our Indigenous students require additional access to specific support so that they are able to be successful in the program. So we have a team that works with the students. We have an Indigenous advisor here at the University of Regina, and we have an Indigenous nursing advisor at Sask Polytech. So one person talks about academic, one person supports nursing and answers those kinds of questions. They work together with the students, identifying whatever needs they have, developing supports to assist them, and we have a priority on recruiting Indigenous students. We try to develop connections and relationships with Indigenous community. We have a pilot project that's currently going on, and it's into its second year. It's a partnership between Kíškus Education Center and Burke's Fox Community School in Fort Qu'Appelle. We have faculty and others working with students in grade 9s through 12 to help to foster interest in nursing and to help them, to support them to become ready to come in. We have sessions for our students around tutoring. We have help for them for self-declaring as Indigenous. They applying for internal, external scholarships. We help them to access elders and knowledge keepers. We have opportunities for them to practice cultural ceremonies and activities as well. We have an annual honors ceremony where we celebrate the hard work, the dedication, and the achievements of our Indigenous students. Family and community members come to witness the resilience and the pride that is demonstrated by the students. We also, after convocation, have a special ceremony where we provide our Indigenous graduates with either an eagle feather or a Métis sash, depending on which they prefer. And then they are recognized among their peers. We added to our uniform policy so that we now have an official SCBSN hijab for students who want that. We have a community of practice that includes both students and faculty around our BIPOC students and faculty. And they meet regularly for discussion on a variety of topics and providing a support for students as well. The deans, both myself and from SAS Polytech, we meet regularly with all of our students, and we have special sessions for both undergraduate and graduate BIPOC students so that they have an opportunity to provide us with feedback, talk about any kinds of issues that they have, and then we can work with them or within the program to try to address those issues. We have an Indigenous Advisory Council It sort of had a bit of a hiatus, but we're reinstating that again this year. And that advisory council is made up of a number of different individuals who advise the program, both programs, on things that we can do to provide better services for our students and ultimately for our patients. The other thing that we're doing is, beginning in the winter term, we have one of our faculty members who is going to have a designated time to be able to work with our BIPOC students. We have 3 faculty who have been working with those students informally over the last couple of years, but now we're putting that into a more formal process so that we are able to support them better. Well, we prioritize our Indigenous and our BIPOC students. Our students work with patients in the hospital, and they work with nurses and other healthcare providers in the hospital. And sometimes that's where incidents occur that are not particularly positive. And so we work with those students to try to prepare them for that possibility, and we try to give them strategies to help them to address if that does happen, and we try to support them when it does. So a few years ago, we had a series of workshops that was provided on anti-racism that a number of our faculty attended. We've added it to it's been in our strategic plan for a while, so that it's something that we focus on. We don't have an actual EDI committee. We do it through our other committees, so that parts of other committees, rather than having a specific designated EDI.
For sure.
Well, we talk about it in the curriculum committee, the program administrative committees, and leadership committees. We've got some, the community of practice is also advisory. They talk to us if there are issues that they've identified that we haven't been able to deal with in other ways. Well, we're getting more and more initiatives all the time, which I think is positive. We have, our students don't always see the changes that we make, because sometimes they're changes that aren't visible to students. But we do take what they say seriously, and we do look at addressing it. So we're trying to put supports in place to help them to be more successful and to help them to thrive in the faculty and in nursing. I looked at our first graduating class, their portraits the other day, and our student body has absolutely changed. We have a lot more diversity in our students for all kinds of equity and diversity, not just with BIPOC population, but in terms of having more male students in the program, more gender diverse students. So we've been successful in attracting students who from a variety of backgrounds and EDI. Well, we still have problems. One would hope we would eventually not have problems, but I'm not sure. I'm not sure that's realistic, and I'm not sure what kind of a timeline that would be. But we do see our students having more opportunities to be successful, I guess. For example, our Indigenous population has increased. For a while, we weren't meeting our target, and now we're up close to our target for recruiting students. We need to support them more so that they were successful. We're trying to, some of these initiatives have changed over time, and evolved because we may not have had the results we wanted, and so we've changed. So it's hard to pinpoint. But we have made some progress. We've worked with the health authorities so that if students experience any kind of issues in the clinical setting, they have the opportunity to, for example, complete an incident report to identify the issue that has occurred, whether it's with a patient or with staff, and then the health authority can follow up. So there have been some things that have been, we've been able to manage to sort of have at least a bit of a solution. Well, and I think the other thing is if something happens to you, you sometimes have an idea of what you want the solution to be. And if you don't see that solution, you don't think anything's happening. I guess I would really want students to know that they are supported in the Faculty of Nursing, that even though we may not always get things right, and even though they may not always have positive experiences in the community or their clinical settings or sometimes classrooms, those kinds of things, that we are trying and we are working to make nursing a better place for everybody, but especially in terms of EDI.